apart from just the, just the kind of the statistical level to discover so many deaths, why is it important? And to that extent, isn't it frustrating that it's so hard to access this data, and also the fact that, okay, when you say that, government says we're not fudging data, you can still understand that if it's a couple of thousand or 100 deaths. But here we're talking of lakhs in terms of the discrepancy. I mean, just look at Madhya Pradesh. Unexplained excess deaths are almost 1.7 lakhs. The official COVID death count is just 4,500.
Yes, this is a very important aspect to understand. Let me just begin with the Madhya Pradesh example. The reported deaths per million is 53 in the Madhya Pradesh state. Now just compare that with Karnataka, that's 294 per million. Even in the way we report the COVID deaths, there is a lot of heterogeneity within the country. So first thing we need to do is get this standardized definition in terms of what is the minimum number of deaths that each should be looking at. Second, even within a state, we should be looking at both registration of death and medical certification of deaths, as Dr. Jha clearly said, by establishing through verbal autopsy. 1 in 4 deaths are due to cardiovascular diseases, Mr. Srinivasan. So what would happen in normal course is whether they got treatment or not, whether they reached the hospital or not during COVID time is as important as whether the COVID-19 infected person is getting treatment or not. So right now, I think we need to be doing two things. One, top-down approach of reviewing the data clearly with clear standardized definition. The other one is bottoms-up approach in terms of understanding what is the community level distribution of the deaths, where the underreporting is more. Currently, there is a sense of fear, and that's why people underreport. That fear has to be replaced by educating that this is most important.
Fear, when you say sense of fear, who's fearful? You're talking of the state machinery, government officials?
I have worked with the public health system for nearly 2 decades. Generally, the first person who wants to report always will have to, fight against a lot of odds. Let's say one system generally underreports. Now, there is a new person who wants to report deaths, then the entire system around it is having different culture. So, that's the reason I said we need both top-down and bottoms-up.
Okay, you need both to...
Right.